started from the bottom. No computer.
Hey everyone, welcome back to another video. Now, this video kind of just came on to me one day when I realized that this month will mark 3 years that I graduated from nursing school, which was a huge accomplishment for me. I filmed, shortly after I graduated, I filmed an hour-long video basically going into my entire experience in nursing school, getting into the program, my time afterwards, all that sort of stuff. And if you guys know me, have watched that video, I think I've even talked about it in some of my vlogs, and you guys would have known that nursing school, working as a nurse, being a nurse, is something that I have always really struggled with. One of the reasons being, I just honestly think I'm not smart enough to be a nurse, being why I went right into mental health after nursing school. And even today, I'm a cosmetic nurse. You know, and even though I love my job and I'm super happy that I made it through nursing school, not to say that my job isn't important, or even my jobs when I was working in mental health, when I was working in hospice, but it was always my mission to find a job in nursing where I didn't have to do complicated nurse things. I will constantly, throughout the years, ever since I started nursing school to now, I have gotten various questions. Even on social media, I have had random people message me asking about a certain health question, something that's going on with them, and I want to say 99% of those questions know nothing about. I have no idea. And I just feel like that's a huge misconception, is a lot of people, specifically ones that don't work in healthcare, think that nurses just know everything. So anyways, when I realized that my 3-year anniversary from graduating from nursing school was coming up, that got me thinking of, what if we just Google a quiz or quizzes specifically dealing with nurse-related things, and let's see just how much I can remember from nursing school. This video may be totally not up your alley. If you're not in healthcare, this may not be fun for you to watch. I apologize if it isn't, but I am genuinely curious, how much do I remember from nursing school? So I have my phone right here. We're gonna go ahead, just Google nursing exam or nursing school questions. So if you would like to come along, try to answer some health related, nursing related questions with me, and let's see how much I remember from nursing school. Okay, so I just went to Google and typed in nursing school quiz. There's this link right here. It looks like it's from quizly.co, and the title of it is, "Can you answer these basic nursing questions?" But yeah, let's start with that and see if they actually are basic or easier questions. Okay, so it looks like there's 25 questions in this one. So the first one, a heart rate between 60 to 100 beats per minute is considered too high, normal heart rate, or too low? That is a normal heart rate. Yes! We're off to a good start. Which of the following blood tests should be performed before a blood transfusion? Bleeding and clotting time, prothrombin and coagulation time, blood typing and blood typing and cross-matching, because you don't want to start a blood transfusion and potentially give someone the wrong type of blood and kill them. So it's going to be the blood typing and cross-matching. Got it right. The standard 5th vital sign is, I haven't looked at the question or the answers yet, but I want to say this is pain, because I do remember this from nursing school. So vital signs, you have breathing, temperature, heart rate, blood pressure, pain. And pain is an option, so I'm going to click that. Got it right. See, I remember something from nursing school. All right, which of the following qualities are relevant in documenting patient care? Organization, accuracy, and conciseness, thoroughness and currentness. And then it has an all of the above. We're gonna put all of the above. Got it right. A 2-month-old child just had a cleft lip repair. Which type of restraint would be recommended in this case? No idea. Okay, so the options are clove hitch, jacket, mummy, elbow. I honestly have no idea. I almost want to say jacket, because you would want to keep, like, I'm assuming they're like arms and hands restrained so they don't like hit themselves or play with their face or anything. But is that like what the restraint's called? I know, I feel like everyone's like heard of like a straight jacket restraint. So I don't know if maybe that's why I'm thinking jacket, but I'm also still kind of like questioning myself because I honestly have no idea. We're just gonna say jacket and see what happens. Okay, that was wrong. So it was the elbow restraint. The elbow restraint will prevent the child from touching the surgical site without hindering movement of other parts of the body. Oh, okay, you know what? That sounds a lot safer than putting a straight jacket on a 2-month-old. This is so embarrassing. Maybe this was a mistake doing this video. A patient has developed thrombophlebitis of the left leg. Which nursing intervention should be given the highest priority? So let's go ahead and look at the options. Apply support stockings, maintain complete bed rest, elevate leg on 2 pillows, apply warm compresses. I almost want to say elevate leg, because I don't think complete bed rest is necessary. We're just going to say elevate leg and see what happens. Oh, okay, so that was right. The first goal of non-pharmacologic interventions is to minimize edema of the affected extremity by leg elevation. Next, which of the following constitutes a break and sterile technique while preparing a sterile field for a dressing change? Now, I should get this one. I feel like following sterile field, it can be difficult at times, but like, I think I should get this one down. So the options are, so again, the question is, what constitutes a break and sterile technique? Okay. So the options are placing a sterile object on the edge of the sterile field. The next one, touching the outside wrapper of sterilized material without sterile gloves. And the last one is using sterile forceps rather than sterile gloves to handle a sterile item. That isn't either, because as long as you're using your hands, forceps, or something else, as long as it's sterile, it's gonna keep that sterile item sterile. So we're gonna go with the first one. And that's right. Okay, next, anti-embolism stockings are used primarily to, I want to say, help with swelling, provide external warmth, promote venous circulation, prevent dependent edema. So we're going to go with the last one because that was like my first thought, was to help with edema or swelling. Anti-embolism stockings are commonly referred to as TED hose, short for thromboembolism deterrent hose. They are used to support the venous and lymphatic drainage of the leg. Like gradient compression stockings, anti-embolism stockings deliver a distributed amount of compression at the ankle and up the leg. In short, anti-embolism stockings are designed to maintain compression of small veins and capillaries in the legs. Honestly, now that I'm like thinking about it, my choice was really stupid. Like, it's literally right in the name. Not only in TED hose, but in the name anti-embolism. So it's going to help prevent blood clots, therefore helping with circulation. This is so embarrassing. I honestly wish I never came up with this idea, because I don't know if I want to put this out on the internet for everyone to see. All right. A patient who develops hives after receiving an antibiotic is exhibiting drug idiosyncrasy, synergism, allergy, tolerance. Well, that would be allergy, because hives is a histamine response, so we're going to go with allergy, which is right. I'm proud I'm getting some right, but I feel like I'm only getting like the really, really easy one right, which I feel like even non-medical people could answer, so I don't really know if this is a win for me. Which of the following patients is at greater risk of contracting an infection? A patient receiving broad-spectrum antibiotics, a newly diagnosed diabetic patient, a patient with leukopenia, a post-op patient who has undergone orthopedic surgery. I want to say the patient with leukopenia, because that's dealing with the white blood cells. White blood cells is what helps fight off infections. So someone with leukopenia is going to be immunocompromised, making it easier for them to catch an infection. So we're going to go with that one. Bam, bitch. Sterile technique is used whenever protective isolation is necessary, terminal disinfection is performed, strict isolation is required, invasive procedures are performed. Obviously the last one. Yes. Next, which of the following statements about chest x-ray is false? So we're looking for the false statement about a chest x-ray. No contraindications exist for this test. I want to say that's false because I feel like there's contraindications for everything. Assigned consent is not required. I want to say that's false. Because don't you have to sign a consent for like everything? Eating, drinking, and medications are allowed before the test. I want to say that's true because it's a chest x-ray. I don't think any of that would affect it. I don't know. Maybe certain like inhalers would affect it. Maybe. I don't know. Before the procedure, the patient should remove all jewelry, metallic objects, and buttons above the waist. I don't think that's necessary. I feel like that's more necessary for like an MRI because of like the magnetic field. No, this is hard. How can I find possibly 3 false statements when there really should only be one? Okay, so chest x-ray. We're gonna eliminate the eating and drinking one because I think that's true. I kind of want to go with the contraindications one. I'm not like familiar with x-ray, so I honestly don't know, but I don't know if like there wouldn't be like any contraindications. You know what I mean? So I think I'm just gonna go with that one. Ooh, okay, got it right. Pregnancy or suspected pregnancy is the only contraindication for a chest x-ray. However, if a chest x-ray is necessary, the patient can wear a lead apron to protect the pelvic region from radiation. Oh, okay, and it also says a chest x-ray is, or assigned consent is not required because a chest x-ray is not an invasive examination. Okay, I didn't know that. All right, next, what does palliative care mean? I should know this one. Working in hospice, it's all about keeping them comfortable, keeping them pain-free. So let's see our options. Curing a patient through a minimally invasive surgery? Nope. Improving the quality of life of patients with serious illness? Yes. Improving the quality of life of aged patients. Now this one could be tricky because I feel like the second and third one are very similar and it definitely could be palliative care for both. But I'm gonna go with the serious illness one because it's more focused on, it's not about like curing someone, it's more about keeping them comfortable and giving them the best quality of life as possible. So we're gonna go with the serious illness one. Oh, okay. Whew. What is the most accurate way to measure core temperature? Before I look at the answers, I want to say a rectal temp because it's like it's more in your body even compared to like an oral temperature. So I want to say that one is more accurate. Got it. Next question. Normal internal body temperature is 99.8, 96.0, 98.6. I'm going to go with the 98.6 because that one's in the middle. I think like the range 97 to 99. So I'm going to go with the 98.6, which is right. Okay, oh Lord, I know this name. What are Korsakoff sounds? I think that's for the blood pressure. Touched on it. It was like the first year because like vital signs was like obviously one of the first things we touched on. And I'm almost positive that the sounds you hear taking a blood pressure is Korsakoff sounds? Oh no. Functional heart murmurs. Sounds heard while measuring blood pressure. We're gonna go with it because that was my first thought. God, maybe I know more than I think. Typically, the influenza vaccine is administered via which route? That is IM, or an intramuscular injection. So let's go with that. Oh, okay. I got nervous. Epinephrine can be used to treat all of the following conditions except cardiac arrest. It can because that's one of the medications you can administer like while giving CPR, kind of help get their heart pumping again. So it's definitely that. High blood sugar, anaphylactic shock. for anaphylactic shock because, hello, EpiPen, it has epinephrine in it, and it can help allergic reactions like that. So, which one it doesn't help is high blood sugar. Fabulous. All of the following are good sources of vitamin A except. Now, nutrition in nursing school and to this day is not my strong point. Like, I know nothing about nutrition. I'm not very good at figuring out like which foods are like high in which vitamins, like which ones are like really good for you, which ones are not very good for you. So I feel like I'm gonna struggle with this one. The only one I can think of that does have a good source of vitamin A in it is carrots. Okay, and now that I scroll down to the options, carrots is on there. But that's the only one I remember. I almost want to eliminate white potatoes. I feel like potatoes are considered unhealthy because they're very starchy. I almost want to say that's like a trick question or that's like a trick answer. But yeah, I honestly have no idea. We're just going to go ahead and guess. And I'm going to say apricots. I don't know why. Oh, darn it. Okay, so it was the white potatoes. So the main sources of vitamin A are yellow and green vegetables. Oh, okay, so that's a better way to kind of remember that, I guess. The nurse explains to a patient that a cough is a protective response to clear the respiratory tract of irritants. I want to say that sounds pretty right. Can be inhibited by splinting the abdomen. It's induced by the administration of an antitussive drug. That is not antitussive, is anti-cough, so it's going to keep you from coughing. That's not it. It's primarily a voluntary action, not necessarily. I think we've all been there in those like really embarrassing situations where like you're sitting in a very like quiet ground public and you get those like coughing attacks and you just can't help it and you're trying to hold it in, but then you just end up like making really weird noises because you're trying to hold your coughs in but you can't. So we're gonna go with the first one. Next, which of the following is not a sign or symptom of respiratory distress? Nail bed cyanosis, breathing through pursed lips. Yes, adoption of a supine position by the patient. So supine is laying on your back. I don't think that would be it because lying completely flat would not help your breathing. You should sit up or at least kind of lay on a bunch of pillows or kind of more in an upright position. An expiratory grunt in children. That could definitely be it as well. So we're gonna go with the adoption of a supine position because if you're having trouble breathing, lying completely flat is gonna just exacerbate that even more. So we're gonna go with that one. Yeah. Next, children are more prone to respiratory distress as a result of airway inflammation or infection because they do not have the ability to become tachypneic in response to respiratory insufficiency. They contract diseases which are more likely to cause respiratory distress, potentially as their immune system continues to develop. They become more anxious than adults, thus increasing the demand for oxygen. They have funnel-shaped airways with a narrow portion that is prone to occlusion and narrowing in disease. Lord, I do not know. I think I'm just gonna go with like the they contract disease one because I just don't feel like the other three sound right. So totally guessing. I have no idea, but we're just gonna go with that one. Okay, I had a feeling I was gonna be wrong with that. The trachea of a young child narrows like a funnel towards the larynx. The trachea of adults is a uniform lumen for its entire length. This narrow part of the trachea in the child occludes more readily during inflammatory and infective changes in the upper respiratory tract. Okay, I did not know that. Okay, carpal tunnel syndrome is caused by compression of which nerve? Okay. I want to say it's either the ulnar or radial nerve because carpal tunnel is dealing more with like your wrist and your hands, and the two bones in your lower arm are the ulnar and the radius. I almost want to say the ulnar nerve. Oh, I'm going to be so mad if I get this wrong, but I'm just going to guess the ulnar nerve. Oh my gosh, it was neither. So carpal tunnel syndrome is a medical condition in which the median nerve is compressed as it travels through the wrist at the carpal tunnel and causes pain, numbness, and tingling in the part of the hand that receives sensation from the median nerve. When transferring a patient from a bed to a chair, the nurse should use which muscles to avoid back injury? So you always want to use your legs, never use your back whenever you're lifting. So we're gonna go with leg muscles. Stunning. Last question here. A patient with no known allergies is to receive penicillin every 6 hours. When administering the medication, the nurse observes a fine rash on the patient's skin. The most appropriate nursing action would be to withhold the moderation and notify the moderation? I think that's supposed to say medication. Withhold the medication and notify the physician. Apply cornstarch soaks to the rash. Administer the medication and notify the physician. I'm gonna go with the first one because even if he's not having any other symptoms, it's still a rash. Especially if he's never taken penicillin before, it could still potentially be an allergy that could lead to something worse if you continue to give the medication. So just to be on the safe side, I personally would just withhold it, notify the physician right away. So I'm gonna go with that one. Yes. Show me my results. So I got 20 out of 25 right. This says you pass with flying colors, but I just don't believe that because I should have gotten all of them right. They weren't even that hard, but you know, whatevs. Let's see if we can find a little harder one that isn't too long that we can try and take. I found another one. This is from study.com. Like, I just Googled like nursing NCLEX exam test questions, which is the exam that you take to become licensed. So even though you graduate from nursing school, that doesn't mean you're a nurse. You still have to study and take the NCLEX to become licensed and be able to practice as a nurse. Okay, so this one only has 15 questions. So we'll do this one. Question number 1. A patient has been experiencing a severe bout with the flu, which caused excessive vomiting and diarrhea. To determine if the patient has hypernatremia, which is increased levels of sodium in the blood, the doctor should do which of the following? Evaluate the patient to see if calcium levels are too high. Determine if the patient's sodium levels are too low. Damn, this is bringing me back to nursing school where like the question and like the possible answers are just stupid. Like one of the options is recognize that the patient has high sodium levels. It's like, okay, yeah, no shit, but what are you gonna do to recognize that? Because it's asking to like, what should the doctor do to determine if the patient has hypernatremia? I don't think it would be recognized that the patient has high sodium levels because you can't just be like, oh, I think he has hypernatremia. Okay, but you have to do something to like figure out if he does. I'm gonna be so freaking mad if that's the right answer because that is just worded horribly. I'm trying to remember. The only ones I can remember is usually sodium and potassium are opposite. So if you have high sodium levels, you're gonna have low potassium, but I'm trying to remember. Okay, I think that's what it is. So sodium and potassium are opposite, but potassium and magnesium will usually be the same, and I'm pretty sure sodium and calcium will really be the same. So to determine if he has high sodium levels, then you could check if he has high calcium levels, evaluate the patient to see if calcium levels are too high. But I also don't know if this question is like easy and it's just basically asking like what is the definition of hypernatremia, so that kind of makes me go back to the last one to see if he has high sodium levels. Oh my god. Okay, we're gonna go with the first one. We're just gonna go with the first one because I don't like how the last one is worded. So we're gonna go with the first one. Oh my god. I told you guys, I knew it. This really is just bringing back like horrible memories from nursing school because do you have any idea how many questions nursing students get wrong because of situations exactly like this where the question or the answer options are worded absolutely horribly? Okay, you know what, you guys? I was about to give up and just turn this video off, but you guys knew. I explained my whole process of thinking, so I'm gonna take this one as a win. I know what hypernatremia means, that is high sodium levels. So even though this is saying it's wrong, I'm gonna consider it right because I know what it means. This was just worded absolutely horribly. A nurse working with a geriatric patient, which is an elderly patient, notices that the patient is unsteady when ambulating to the bathroom at night. Safety measures the nurses should take include all of these except. So which one is not going to keep him safe from falling? Keeping the call light near the patient, that's going to help. Teaching the patient to use a walker, that could definitely help. Leaving a nightlight on, that could help. Applying restraints isn't going to do shit because this is about walking safely and keeping the patient from falling. So that one is definitely not going to help with safety. So it's that one for sure. A person is dehydrated and is given 500 mLs of normal saline. How many grams of sodium chloride will the person receive? I'll be honest, I do not remember the conversion of milliliters to grams. We're going to guess and say 9.5 because I don't remember. Okay, it was 4.75. Okay, we're just going to move on. A local hospital is preparing for an influx of COVID-19 patients. In order to break the reservoir link of the pathogen chain of infection, the hospital should do which of the following? Remind employees of appropriate hygiene protocols, supply staff with appropriate PPE, require an increased use of disinfectants, establish a quarantine floor. So to break the reservoir link, I want to say it's either the PPE one or the quarantine floor. Reservoir, I think, is like the first link in the chain, and that's where like the illness is like housed. So I want to say quarantine floor. Oh, okay, I got it right. Marie is an elderly patient with kidney disease who is concerned about her health care should she become unable to make decisions about it. She has selected Nancy, her dear friend, to be her health care proxy. To ensure that Nancy follows Marie's wishes in the event that she becomes unresponsive, Marie needs to do which of the following? Sign a DNR form, file a personal representative form, create a living will, create a healthcare proxy. So this is the living will, which is correct. Mr. Fitch has been admitted after having a stroke. He has right hemiparesis and needs help with transfers from bed to chair and is unable to ambulate without help. He is very thin and bony and has been incontinent of urine. The nurse should do which of the following? Determine if Mr. Fitch is suffering from malnutrition, examine Mr. Fitch for any peristalsis infection, evaluate Mr. Fitch for dehydration, consider Mr. Fitch might be at risk for decubitus ulcers. So I'm going to go with this one just because he's unable to ambulate, get up, walk around on his own. Being incontinent, sitting in your urine or feces can break down your skin, and also being thin and bony, sitting on bony prominences, that's going to lead to an increased risk of skin breakdown, leading to ulcers, so it's definitely the last one. A nurse receives an order to give 1 million units of procaine penicillin IM to a patient. On hand, the nurse has access to a vial that contains 600 units per ml. How many mLs will a nurse draw up from this vial? I'm going to make this real easy on myself. It's definitely not going to be more than 2 because 2 mLs, that would equal 600,000 2 times. So it's definitely going to be 1 ml and a little bit left over. And there's only one answer option that is 1 and a little bit left over, which is the 1.67. So we're going to go with that one. Bam. A patient comes into the ER one night with severe right lower quadrant pain. So this is abdominal pain. He is intoxicated with a blood alcohol level of 0.10. After reading the result of his abdominal ultrasound, the doctor determines that the patient needs an emergency appendectomy, so he needs his appendix taken out. The OR consent needs to be signed. Which of the following should a nurse do? You know, these should be like easy, but sometimes these can get very tricky. Okay, so contact the patient's spouse or emergency contact to come and sign the consent form. Get the consent form, put it on a clipboard, and have the patient sign it. Give the patient a cup of coffee to help him sober up, then ask him to sign the consent form. Notify the surgeon that the patient is drunk and cannot have the surgery until he sobers up. That's putting the patient's life at risk, so I don't think it's that one. I almost want to say just giving it to the patient and having him sign it. This is where it gets tricky because like he's intoxicated, so he's not in his right mind. But at the same time, if he's responsive, you couldn't bring in like the next of kin, like his spouse or something to make that decision. So I'm going to go with having him sign it. Really? But hey, you know what? In a real life situation, if I was ever, put in this type of situation, I would always go to someone else for help. Oh yeah. This video is so embarrassing. A nurse is emailing another medical institution to receive medical records on a recently admitted patient. Prior to sending the email, the nurse must do which of the following: make sure the email is encrypted, double check to make sure that the information was not already sent, consult with the interdisciplinary team to see if the email covers all the information they need, check with the patient to see if he, she, or they has any medical information on him, her, or they. I'm sure they would have already done the last one. But I'm gonna go with the first one, make sure it's encrypted, because that's what like protects your email, which is correct. A patient is having a grand mal seizure. The nurse in the room immediately checks to make sure the patient's head is safe and then pats the sides of the bed rails. What else can the nurse do to ensure the safety of the patient? Right off the bat, I know something else you can do with seizures is turn them on their side safely, just in case if they were to have a lot of secretions, they don't end up choking or pretty much drowning on their own secretions. So by turning them on their side, that lets the secretions, you know, work with gravity, drain out of their mouth. Make sure the patient does not turn over. Hold the patient's head up and try to give him water. Absolutely not. Try to hold the patient's arms and legs down. Roll the patient on his side. What did I say? What did I say? A hospital has received a bomb threat. Oh God. And management immediately employs its paging system. By using a dual purpose system, management will be able to do which of the following: communicate directly with 911 services without having to alert anyone else, thus avoiding chaos. That is not a good idea. Alert appropriate officials, nearby institutions, and personnel of the threat. I would say that's pretty correct. Communicate with key officials who need to be aware of the situation before the public is alerted with a set amount of time thereafter. Alert hospital personnel of the alert code so that they can prepare themselves, patients, and visitors as needed before police and fire services are alerted. I'm gonna say the second one because that way you're alerting everyone involved, including like 911, hospital staff, alert them at the same time. I would say that's the smart way to go. So we're gonna go with that one, which is correct. Mr. Wilkes has been admitted for possible sepsis and dehydration. He has mild acidosis. Which of the following actions would be most appropriate for the nurse to take? Order an IV of normal saline, prepare a solution of dextrose to administer to the patient, give the patient an IV of lactated ringers, administer a dose of dextran. I do not remember at all. I don't think it would be dextrose. I don't think you would give them sugar. I think that would just like drive the infection more. Can't remember though, but I know like lactated ringers is used for like something specifically. It can be used for other things. I just can't remember. I almost want to say just go with like normal saline to keep the blood pressure up. I'm just gonna say normal saline. Honestly, total guess. I have no idea. It was lactated ringers. I guess that would make sense because with sepsis and acidosis specifically, there's an electrolyte imbalance, and lactated ringers is one of those like solutions that has a ton of like electrolytes in it, I think. We're almost there, guys, almost there. Robert is an 85-year-old patient who wishes to be an organ donor after he dies, but he no longer drives, so he has no driver's license. How can Robert let people know? Get a card for his primary care physician to carry in his wallet, register in the state where he lives via the government organ donor website, or write a note to that effect and carry that in his wallet. I want to say go with like the register on the website, so that way, you know, everyone's aware, and that's a little bit more like an official compared to just carrying like a handwritten note. The doctor has ordered Procrit 5,000 units subcutaneously for a patient with chronic kidney disease. How should the nurse proceed? The nurse should give this injection in the upper outer quadrant of the buttock. It's not usually where you would give a subcutaneous injection, so I'm gonna say that's wrong. The nurse should give this injection in the back of the arm. The nurse should give this injection the vastus lataris muscle of the thigh. No, that is an intramuscular injection. The nurse should give this injection in the ventrogluteal muscle of the hip. Again, that's a muscle injection, so that's not gonna go there. So we're gonna go with the back of the arm, and that is right. Last question. I have such a headache. A new nurse who has just completed orientation is overwhelmed by her assignment for the day. Girl, same. Which of the following approaches should the charge nurse take? Reassign one of her patients to a nurse's aide, nurse's aide can't take on patient assignments like that, so no. Report her to the nursing supervisor. That's inappropriate as well. Scorn her for being... I'm just gonna stop right there. Don't scorn her. She's brand new. Give her a break. Ask her in a kind tone what she's overwhelmed with and how the team can help. Now that's the way to take charge and help a girl out. So it's definitely that one. View results. I got a whopping 73%. Awesome. All right, everyone. I am exhausted from those quizzes. I feel like I need to go take a nap and take a break from life real quick. I don't really know how I feel about those. I feel like I got a good portion of questions right, but I also feel like they were the questions that most people would know by just using common sense. I don't know. I don't really feel any smarter from that. I feel like I definitely lost a lot of knowledge from nursing school. And honestly, if you are in the medical field, if you're a nurse yourself or going through nursing school, I hope that this video in some way helps you. If you're struggling, if you have the same thoughts and feelings that I did going through nursing school, that it just wasn't for me, I'll never be a good nurse, I'm not smart enough. I hope this video and just me in general serves as an example that you can do it if you stick to it. And you're not God, you're not a miracle worker, you're not gonna know and remember everything. I sure as hell don't remember a majority of the stuff I learned in nursing school. Put myself down a lot for not knowing these things that I feel like I should know. But you know what? It's life. You're still gonna be awesome at whatever you do. So yeah, I hope this video was helpful to you in that way, or maybe just entertaining for you. And I'm gonna get going for now, but I hope you all are having a wonderful day, and I will see you all in my next video. Bye everyone.